Regarding Fixtoe, we will have the presentation done by David Lucas, who is the co-founder of Fixtoe. He's a podiatrist, and he also invented and developed the device Fixtoe. So I introduce to David. Please feel free to do the presentation, and thank you very much for attending this meeting.
Okay, hello to everyone. I share my screen. One moment, please. You can see it, Pablo?
Yes.
Perfect. Okay. So first of all, thank you very much for your time and willingness to get to know Fixtoe. I'm going to try not to go too long and explain it a simple way, all right? So I'm David. As you say, I'm podiatrist and CEO of Fixtoe company and co-founder with Dr. Framonceau, that is scientific director of the company, all right? This is the index. This is the points. Who are we? Or differential value, devices, Fixtoe Pro, indications and contraindications, Fixtoe QX, indications and contraindications as well, and commercial strategies, commercial tips that have worked for us over the last 5 years. So who are we? We are a team of Spanish podiatrists who innovate in devices that prevent and treat the most common pathology of the population. This is my partner, Dr. Framonceau, the most wonderful mind I have ever met, and the mastermind behind all devices that we develop. All right, this is the scientific director. This is our differential value, lies in the fact that all the products we develop have 3 fundamental characteristics. First, everything is designed by podiatrists with more than 20 years of clinical experience. Secondly, all products that are patent and scientifically endorsed. And third, all the products have high rotation and recurrence in the market, so that it also makes business sense. All right. This is our 2 devices that we are in the market in this moment. We have Fixtoe Pro and Fixtoe QX, that which I'm going to present to you below. All right. Well, so the innovation that we have carried out is basically an evolution of the adhesive tape and pads that we use in the clinics. This is what worked for us to treat the pain caused by toe deformity. Previously, a tape bandage with adhesive tape was used to correct the deformity plus a horseshoe sucks to alleviate the pain and inflammation of metatarsalia. This is joint. The result of this is Fixtoe Pro, the tie bandage, and horseshoe shocks, all right? Which is the problem that the clinicians have with the tape? Well, the first problem is that the tape irritates the skin with this form, all right? The patient cannot wash his foot. The consultation time is lost of the patient finds, and it's difficult to make the bandage himself by patients. So by that's why they created the Fixtoe device to solve the problem caused by adhesive tape. Fixtoe Pro is designed to treat the pain caused by digital deformity and has 3 parts. The first part is this. Is a thin antibacterial bandage within anti-slip silicone, which imitate the adhesive tape. The second part is that a removable horseshoe relief pad to relieve the area of pain or inflammation. And third part is that, and it's one size fits all breathable elastic band that is placed in the midfoot to anchor both parts, that and that, all right? The indication for the Fixtoe Pro device are for all metatarsalgia associated with the toe deformity. The clinician indications are metatarsalgia, predislocation syndrome, capsulitis and forefoot pain, in addition to floating toes, cloud toes, and hammer toes. The contraindication of the Fixtoe Pro device are patients with diabetic foot, patients with silicone allergy or skin pathology, patients with rigid deformity or arthrosis, and oedema or open ulcers. The Fixtoe QX device is indicated as a post-surgical stabilizer for hallux valgus and true deformity. It is like Fixtoe Pro device, but with a hallux valgus splint, and 3-2 bandage, because as hallux valgus is rarely operated and alone, always is operated with a second or third two. The indication for the Fixtoe QX device are for all metatarsal and digital osteotomies. When the swelling is reduced and the stitches are removed, Fixtoe QX is placed for 3 months to prevent post-surgical floating tooth. And this diapositive is, this slide is for to compare the last version and current version. It is like that many of you know the old Fixtoe device that we created in 2019. That is why I have this slide, all right? So that you can see the evolution and the big difference with the current device. So that if you have clients who knew the old one, you know well the evolution. The old device that was with 3 sizes. The bandage was fixed. It was differentiated between left and right foot, and it took more space. The current Fixtoe device is 1 size, has a removable bandage and removable pad. It is also bilateral, the thinnest fabric on the market, and is compatible with orthopedic insole, and is available in beige and black color. And the last slide is some of the commercial tips that have helped us the most in recent years with our customer, right? First, selling in packs of 5 and 10 units. This leads to a higher product turnover and higher average take and facilitates the consultation with professional by having a stock of device in the clinic for possible unexpected cases. The comparison with the traditional bandage, this causes the clients to understand perfectly the advantage of the device, as they know the problem that the old bandage gives there in the clinic with the adhesive tape. And complementary device with orthopedic insole and metatarsophalangeal infiltration, this causes the client to earn more money on the client's ticket increase, and because a treatment is added to what they were already doing the clinic, all right? And the last commercial tip is offer the device as a night splint. This means that the patient buys one for day to day one use and another for sleeping. This makes that more rotation benefits and for our clinics. All right. So this is the last slide. Thank you very much for your time, and I'm at your disposal for any question you may have.
Right, so Paulo? Thank you very much, David, for the presentation. Do you have any questions? Please feel free to ask in the chat. Also, meanwhile, you make some questions. For example, common questions that people usually do is like, I have always to put the cushion in area or not?
The cushion, sorry, Apollo?
La almohadilla.
La almohadilla, all right. You can put this without an insole. If you put the insole, you can take off this because the insole relieves the pressure in this area, and the bandage correct the deformity. So if you put to the patient the insole, only put the bandage, all right? If you don't put the insole, you can put these horseshoes to relieve the pressure or the inflammation in the metatarsal area, all right?
Okay. And from what age is recommended to use it?
It's between 14 years old to 80 years old, right? But if you have a patient that has a pain with maybe has a sport patients, you can put use to relieve the pain, all right? But the most common years is between 40 to 18 years, right?
Okay, great. It is washable.
Yeah, is you can wash the product with okay, Pablo Jose lavar a mano with a machine.
Okay,
Right?
we can wash it by hand. Okay,
Right.
by hand and clean it, and
Not
don't
use
use
machine. Yeah.
washing machine, right? So, yeah, we can wash it, and so the rotation of the product, how long we need to wear it?
It's between 3 months to 6 months.
Okay.
It depends of kind of the patient, all right?
Okay. And the sizing, it's only one size. From which size to which size it's in the device?
Yeah, the European size is between 35 to 45. I don't say that in American size, but it's only one size, elastic band. The last device we was three sizes, but the current device only have one size to this elastic band, all right? And it's between 35 to 46 of size, European size.
Okay. Okay, and then the biggest advantage of the product is over the traditional bandage, right? Because
Yep.
it's easily to wear in the shoe.
Yeah, it's the big difference, no? The last bandage is more big product and is all fixed, and you need to the right and left foot, and this is more versatile and is compatible with insole. It's very have many indication, no, about this.
Right. Also, as many of our public is from Arab countries, that usually wear in most of the year sandals. This device could be great for closed shoes as well, which could be provoked by walking by sandals too much time.
Yeah, you can use with any type of any kind of shoes, and I recommended this color to the sandals and maybe the black color to the boots. All right, is the color is more for the closed shoes. This color, right? But you can use with sandal and with boots too.
Okay. Important is to say that this product has no competition because it's a patented device. The competition is the traditional bandage, which
Yep.
is uncomfortable to wear on the shoes and also takes more time for the practitioner to do it. So the product has many advantages. Also, it's a product that it's rotating fast, and also it's making your customer loyal, as you could only find this device from you. Okay, it's the only device that covers this pathology. Okay, so please feel free to ask any questions. You can raise your hand.
Right, Pablo, you can, I don't say that you can cut this bandage, all right? You can cut depending of the two of the form of the two of the patients. You can cut this to personalize the two, all right? It's a thinnest and it's the same two tape, the traditional tape, but with the advantage that is orthopedic treatment, no? You can see that.
Yes. Also, I think you can cut the cushion, right?
The pad, yes. You can cut if you have inflammation in the metatarsal area. You can cut to download this inflammation, all right? And if you don't put the insole, you can stay there to relieve the impact of the floor, right?
Okay. So, and no questions? Everything is clear? I don't know, maybe David, you can tell some tips also of sales.
Yeah,
Meanwhile,
it's basically all deformities of the tooth and all the pain in this area. The Fixtoe devices treat this, all right? Not only treat, if don't, but prevent the deformity too. So it's very, very easy to understand the product, and we make this to all line to the commercial profiles, understand to sell this product. So the idea of the product is treat the pathology and prevent the pathology, all right? I think it's very easy to understand, and it's very, very rotative product in the market. I think it's all clear for you, Pablo.
yeah, everything is clear. So if you don't have any questions, or maybe later will emerge, if you have later questions, we can ask David, or I can answer your questions later. So thank you very much, David,
You're welcome.
for the
Thank you for your
presentation.
time.
So I think we can immediately start, since we don't have that much time. And as usual, we will just show you our presentation. And if you have any question, please just stop us, and we will just take care of your inquiries. Is it okay, Pablo?
Yes, go ahead. Thank you.
To Anna directly.
Thank you.
Okay, so thank you very much to everybody to stay here with us. I'm a physiotherapist, and I'm using the diathermy since 2005. So it's near 20 years that I'm using the diathermy in all of the cases or treatment that you can imagine. So please, if you have any question about all this device or about the treatments on how they works, please let me know, and I try to explain how it works. So computer here. Okay, I hope you can see the presentation. Yes.
Yes, we can see.
I don't know why it is this way. Let me try. Okay, so
you can enlarge the screen, Anna, or it's already maximum?
I don't know, because I have all the things here and I cannot open. Let me a second. Let me a second. I will try. No. Okay. Okay. Do you see this way?
I think it can fit.
Okay. So what is the Takkar therapy? The first is to know what is that. This is a electrical transfer, capacitive and resistive electrical transfer. This is what does it mean, and after that we have all the how it works and why it makes the effects in the tissue. So we have a active electrode and a neutral plate. Then we have a electrical current in the middle. And there is where we put our bones, skin, muscle, or the human tissue. So when we have this electrical current between one electrode to the other is when we make the effect in the area. These effects we can have some effects, of course, in muscles, in skeletons, so we can use it for sports, to recovery after the if we have imagine pains, edema, hematomes, but of course we can use it too for when we have other kind of problems like chronic pains, for example, when we have arthritis or other kind of problems. We can use them because we can use it with the massage. So we have two effects. One side we have the effect of the electrical device, and after we have the our manual therapy in the same time. What does it mean? That this is very, very, very comfortable for our patient. And the result is that we have less pain and our treatment is better than when we use only, for example, the manual therapy. What we do with the TECAR therapy, we can use we can some ways. All of the therapy is that we put air inside the body of the patient. This is thermotherapy. This means we are increasing the temperature that because of the body is making things for this temperature. It's not like we put a thermotherapy that we put only
Ana, te perdemos de vez en cuando, perdona. We lose you.
Yes, your internet connection seems a little bit slow, because we lose your voice sometimes.
Yes.
I don't know. What can I do? Let me try. Maybe I can. Is it okay if I put it in my phone and you pass the presentation? Maybe it's better. ¿Entiendes, Wendy? A lo mejor si tú pasas la presentación.
Ok. Ok, intentamos.
Yo me conecto desde el teléfono porque no sé por qué pierdo la conexión. No debería perderla.
Ok, intento yo. Para compartirlo tienes tú que dejar de compartir, ¿no?
Voy a intentar conectarme entonces desde aquí. Me tendréis que volver a dar acceso, ¿vale?
Espera. Oh, no sé por qué no me lo hace hacer. So I'm sorry for all this trouble. That's okay. Can you see my screen right now?
Yes, we can see it, Gwendolyn.
Okay, I'm Miss Union, eh?
Okay, your time. Okay, Anna, do you see my screen?
Yeah.
Okay, can we restart from here?
Let me try this way. You put this and I talk. Is better now? Can you hear me okay now?
I think yes.
Okay, maybe if I don't share, it's better for the connection. I don't know.
Okay,
Yeah,
we try.
probably.
We try.
Probably yes.
Okay, so okay, so we are saying that we can use the diathermy for increase the blood circulation, the put less the pain, have a better atrás. Una más adelante.
Okay.
Yeah.
No,
so what is how does it work? We have two kinds of electrodes. We have resistive and capacitive. When we use the resistive, we work with the Joule law. What does it say? It says that when you put the electrical in the tissue, it works in the tissue that has more resistance for this electrical current. Which kind of tissue will be in our body? Of course, the tissue that don't have a lot of water, for example, bone, cartilage, capacitive technique, we have another concept. We have or we works in the body that in the tissue that has more water. For example, in muscles, circulation, lymphatic system, adipose, and other structures. Imagine if we have edema or we have a post-surgery that we have very early, we can use it for put out the hematoma too, okay? So it depends on which kind of structure we are trying to treat. We are going to use one electrode or the other. In the most of the cases, we share these two kinds of electrodes. Sometimes we begin with capacitive and we continue with resistive because we want to mix the effects of this electrode of this technique. So here we have the imagine. When we use capacitive, we're working with the ions. They go to the electrode, so they move to one electrode and to the neutral plate. So they move it. And when we work with the resistive, we have the current inside the body, and then in the harder area is where it makes the effect. Okay, this is very important to be clear because it's the base for the all the treatment. Continue, please. Okay. In general, when we use these complementary technicals with the capacitive and the resistive, what we make, of course, and we are going to talk now about that, it's going to depend on if we works in low, medium, or high power, but in general, we increase the extensibility of the collagen tissue and reduce the viscosity. What is this? This is very interesting when we are working, for example, when you have a muscle very hard and very painful. when you become using the TCAR therapy, you can feel in your hand how the structures goes softly. And this is very, very interesting because the patient is going to have less pain, but you are going to have a better movement in the area or in the articulation, okay? In another way, you have pain relief, reduction of the muscle and spasm and contractures, a better acceleration blood, and not only blood reabsorption, you have edema reabsorption. This is very, very, very good with the diathermia. When you use it, you can see from one treatment at the first and at the finish. When you finish, you can see how it goes out. How can you move it better? How can you feel it better? Okay. You have other thing is that the dissociation of the oxygen in the hemoglobin is better, is going better. So this chemical reaction put the metabolism in a good statement. Of course, if we put a very important temperature and power, you will have an important vasodilatation in the area. What does it mean? That you will have better or more blood flow and of course oxygen. This is better for the metabolism of the cells. Now we can put next, please. We can work two ways, with thermal effects or without it. When we are working without thermal effects, we will work in athermic treatment. What happened in the athermic treatment? That we don't have the blood effects. We don't have more nutrition. We are not going to have more blood in the area. But it's very interesting because we are going to have an effect in the electric currents, that we will have a promotion of the reduction of the pain. We are going to have a better vascularization, but for the reduce, for clean the area, because we are going to have a better equilibrium.
Yes, balance.
Balance in the membrane, in the cells. So this is a very interesting way to use when we are in a very painful or just post-surgery moments. When we want to look
so
for...
may I say, Anna, sorry for interrupting you. This is interesting because from a commercial point of view, one of the main questions when we are approaching for the first time diathermy is, can I use it in acute state? So the answer is yes.
Of course.
Right?
Of course, yes. And it is very, very, very useful, but you need to use it in a thermic treatment without temperature. Because if you have a big hematoma or a big edema and you put it more blood, it will grow a lot. So the patient will be worse. But if you work without thermal effects, you are going to accelerate the normal process in the body. So all of the moment will be better. When we work with temperature, we will work looking for this blood who have more blood, more nutrients, and more oxygen in the area. Here it is. So yes, yeah, here it is. So we are always, with the diathermia, we are always helping the body to repair with the natural repair process. This is wonderful because we are helping the body, helping the process. We can start without temperature, making better this damage of the electrolytics areas, and after we put the temperature and then we increase the internal temperature, we make better this metabolism with products more oxygen, with increase the velocity of flowing, not only for the blood system, because we are working for the lymphatic system too, okay? And this is very, very, very interesting. Continue, please. Okay, no, one less, una menos. Okay, here we have all the effects that we have is what we are going saying. I always say that I'm in love with the diathermia, and the diathermia is, you can use it for everything if you know how it works. So you can use for scars, for pain, for post-surgery in a very early time. You can sport traumas, vascular spine, all the pains of the patient you can work with. Please, one more. When we talk about the patient experience, is the most important is that normally the patients love the diathermia because it's very comfortable for them. It's something that is very safety, and it is very, very, very efficient. So you don't have pain when someone puts the diathermia in your body. You are not going to have a pain, a scar anywhere. So you are going to feel better, easier, and quickly. So this is perfect for the patient. And when we treat the area, the diathermia normally works for the neural system in the body. So you make a relax in the patient. So it is very, very, very comfortable. It is so efficient because we are helping the body to repair. And this treatment, the physiotherapists, the podologists, now the sanitary persons are starting using again. But we are working with the diathermia more than 40 years. So it's something that is, of course, it has studies, it has a good effect, and it's very easy to have the experience on how the diathermia is. Pásame por ti. Okay, now we are going to see the devices that we have. We have 4 kinds of devices. The first one is the T-Care Compact. After, the second is T-Care Compact XP. The third one is the T-Care Plus, and the last one is the T-Care Plus Bag. So if we go one by one, we are going to this. The T-Care Compact is a small device. Is very comfortable to it's very comfortable to you can bring it wherever because it's BDSC, is small, but it is very useful. You have one frequency. You can adjust the power from 200 to 250. And you can, of course, work in continuous or pulsed emissions, and you have the capacitive and the resistive electrode. So you can use the control with the knob or with the screen, okay?
Yes. Can I just add something? So all our devices, as you can see, they do have a light indicator. So it will help you to recognize which is the active electrode. We have a safety cover, okay, a protection for mainly for the operator also, but for both operator and patient. This is a very useful issue when promoting the item, okay, because we take care of this, both operator and patient safe. So consider that working with diathermy is a daily work. So people are working not all the day, but there are also therapists working all the day with this machine. So we have to take care about the safety of the operator as well, okay? So this is an important issue, I think interesting for you, okay?
Yes, this is very interesting what Wendy is saying, because when we work with the diathermy, we work with it in this way. So we put here the electrode and we are making our manual treatment at the same time that we use the diathermy. So with this plastic, we are safe for the temperature, and we are not in the middle of the circuit, electrical circuit. Okay, so here we have the resistive, the capacitive, three kinds of measure. We have a flexible plane. It's very good that it has in the last part something that is covered, so the patient is not have any put in any pain there. This is very interesting too, and it's very interesting that it is very flexible, so it can put in the body very together. I don't know if si me he explicado, Wendy.
Yeah, so Anna says the flexible return plate is the passive electrode. So we said capacitive, resistive are the active, and then you have a passive electrode. We have now a standard flexible return electrode, which fits very well. Consider you want to put it on your belly, on your back. So it suits better than a rigid plate. We also have a rigid plate, okay? But this is more comfortable, and this comes standard with the machine, okay?
Okay, and you have, of course, a small backpack that you can transport it very easy. So it's perfect if you have, if you are in a sport club, or if you are moving from one clinic to the other, or you have patients in the houses, for example. Okay, next one. Here we have the XP. This is a very interesting device. We have two frequencies. We have 500 and 1000. Now, after we are going to talk about the frequencies. Now I will let in this moment, in this point. We have two kinds of electrodes. We have the capacitive, the resistive, but we have a very interesting electrodes that are the bipolar electrodes. These electrodes, face and body, these hand pieces are special for treat the skin, or a very or areas that are very in the very near from the handpiece, okay? Why? Because it's not going to go down the electricity, it's only to stay there. So it's not interesting only for the scars, only for the skin. It's very interesting, for example, imagine for the tendons or the ligaments and the articulations in the hands, in the fingers, when we have pains here in our hand, or in the ATM areas that are very next to the or near the electrode, the handpiece. We have a very good power in this device. Is 300 and 400. We have a screen, a touch screen in a color display. We can use it in continuous or impulsed emission, and we can use it or operate by time or by energy. This is very interesting because when we work with time, we only put the energy that we want and the time that we want, and we have the feeling, what sensation that we have, what that the patient has. When we operate with energy, we want to put, imagine 2000 joules in this area. So I put it in the device, in the display, and when I reach the 2000, it stops it. Okay, we have the same power control knob and the handpiece, resistive, capacitive, but here we have the bipolar too. Very, very interesting. Okay, continue, please. Of course, we have the same plastic for cover for our hand be safe.
Yes, I would say just to a few words. The main difference between Tekka Compact and Compact XP is the possibility with XP to have two frequencies and the configuration with the dermatofunctional probes, as Anna said, for face and body, but not only, okay? Those probes have a return plate at in the same face, in the same surface. So they do not need any return plate. We will see it later. In any case, you will keep this presentation, you will have the specification. So the description of the configuration of the items, okay? Shall I move on, Anna? The next one?
Yes, please. If we continue with the Ticker Plus, this device is bigger. It has 4 frequencies. It has 4, well, you can see there, you have 420, 500, 720, and 1000. You have a good power for 300 or 400, and you have a touch screen. You have the same. You can use it by time or by energy with continue or pulse emission modes, and you have the power control knob. Here you have 3 electrodes, capacitive, resistive, and the difference is that you have here more frequencies, okay? And the device is bigger. Now you can put, if you want, like an accessory, the bipolar electrodes that we will see after one by one, okay? Is why I'm not stop it now here, but we have so many accessories in this kind of devices that we can share or we can mix our treatment. It's very interesting. Okay, if we continue, we have here the Ticker bag. This is a very good device. It's the same as the Plus, but we have one more thing. Here we have electrodes for intracavitary area for urogynecological rehabilitation. So we have musculoskeletal physiotherapy, dermatofunctional physiotherapy. So we can use for muscles, we can use for bones, we can use it for aesthetic problems, but we can use for urogynecological problems too. And the most important thing is that we have 2 intracavitary electrodes, one monopolar, the other is bipolar, that they have a temperature in the handpiece that you can see all the time. You can know all the time what temperature you have in the patient, inside the patient. So this is very, very, very important because when we work in the urological area, we know that the mucus has a different sensibility as the skin. So the feeling of the patient is different. So we want to know, where are we? What temper that we have in each moment, okay? So we can work all the things that we can work with the plus, and we have here all the urogynecological treatment, okay? Vale. Un poquito para atrás.
Okay. Por atrás.
Okay, here. Vale. Now we have here the standard key that we can see in each device. We can see the handpiece with the capacitive or resistive. I don't like to see, okay, blue is capacitive, red is resistive. I prefer that you know that when you have the black one is capacitive, when you have the metal one is resistive. The elbow for me are perfect because I love to work with this in this way, not like a pencil. I like to work with the elbow. Flexible place. We need to change this photo because the
Yes, it's old. It's old.
The new one is better than this and is a very, very good flexible return plate. It is flexible, but it is good. It's comfortable to use.
Yeah, and now the actual flexible plate comes with a cable, which is one piece only. So you don't have any to pinch anything. So the cable comes directly with the plate. It's one piece. So I'm sorry, this picture is not updated.
The adhesive return plate is very interesting. After we will see it, it's very interesting to work when we work with the movement. When we want to have our patient move, with making moves, and imagine we want to make like it sit and stand up, sit and stand up, and we need to work in an area so we can use it. Or when we want to move the patient at the same time that we are making the diathermy, and the area is a difficult area for us, okay? We have a resistive functional electrode. This is for work in hands off, okay? So we put the electrode and then we work in hands off with the machine. This is the three kinds of capacitive and resistive with the three diameters, and with the cover, the plastic cover. The capacitive convex is very interesting. This is optional in the other, but it goes with the bag. This is very interesting for when we are working with edemas, or imagine in the pelvic areas that we have areas that we need to cover better than with the other, okay? The ogival electrode is interesting, and we use a lot of time for working in inside the urogenital area. But of course, since we have the thicker plus bag, for me, it's not. It has no sense to continue working with that because the new electrodes, bag electrodes, are very, very good. They have all the they have the temperature control, so this is perfect. We are not going to have any doubt that we are going a good working or good work. Sorry. Okay, the multiplex is resistive electrode. This is for works big areas with hands-off mode. We see before the bipolar body and face aesthetic bipolar electrodes. This, as Wendy says, we have there the plate and the return plane and the electrode in the same. So when we use it, we don't need to put other plate. Here we have in the down the dynamic return electrode. This is very interesting to work in 360 degrees imagine in an elbow, in a knee, that we are working with the plate return, with the handpiece, and we are working this way. This is very interesting too. The cylindrical return handpiece is, we take it with our hand, the patient will take it, and then we make our treatment. So it is working, it can move. For example, imagine you are working in the elbow and the patient is open their arm, close the arm, open them. So you are growing the movement in the body. Okay, we have the AMT. This we will show you after a small video, but this is interesting for work in the fascia. It's very, very, very interesting. And it's very interesting to introduce this therapy like a first step in our treatment. That when you do that, your treatment should be quickly, easier, más rápidos, faster.
Faster, yes.
Okay? So we have some kinds of models of the AMT, and you use the one that you want for the area. Now you can see here, okay? Now this one is the fourth. Okay, you can work hands off or hands free. It's very interesting if you can let the patient working with the diathermy while you are making other things, imagine with other patients or whatever.
And Anna, just to say, you can work, it works like a hand. So it starts from one part to the other, okay? So 1, 2,
yes,
3,
it's very
4.
interesting to be, and for the safety of the treatment, it's very interesting that when he's saying you work one, this switch on, switch off, switch on, switch off. So it's the current is going from one to the other. So you are not going a very important thermical effect in one of these. So you will be or will have a safety treatment too. This is the bipolar aesthetic handpiece that we are already talked. This effect is very interesting, very important, and you can see it in the same moment that you apply it. It's very interesting. Those are the one that I already talked, the electrodes for pelvic floor. And you see that we have the one that is the monopolar for towards outside, but very near. You see from the episiotomy and just in the door or the pelvic floor, okay? And after you want to work inside, we use the bipolar. Why? Because it will be covered for all the pelvic floor, okay?
Okay, if you want, I can just tell briefly. It's an overview. I'm sorry for the entries, which are okay. I hope you can just read them. So any device will just show you this table, which are the options included. Okay, for instance, the compact, which we said it's the entry level. Okay, does not work with automatic, it does not work with the physiostatic, and it does not work with the pelvic probes, okay, which are supported by the VAC. So VAC has all the options on board, okay. Teca Plus can work with automatic and physiostatic, which are in any case optional, but not with the pelvic floor probes. And the Compact XP can work with physiostatic probes, but not with automatic, not with pelvic floor. The only thing I want to say is we have seen the automatic option, but you know you have it in within the accessories. You can work with a resistive functional electrode, which is a simplified automatic version. In any case, you have this option available in any device, okay, which does not replace the 4 outputs automatic cable, but you have one output. In this way, you can have a simplified automatic version. Okay, Anna, if you agree, I will just try to show this short video. Shall I go ahead? No, just a second. Let me check if it works. Okay. Anna, are you there?
Sí. Yeah, I'm here.
Okay. No, I think I don't know how much time we have. I think 10 minutes. So this is an overview and a resume of our Tecker devices. Okay, so with the main claims, with the main let's say features. So as we said, safety first, because it's easy to develop devices which are effective, but also can damage, the operator first by using a technology every day. So for us, it's a very important issue, and I think you should use this issue as well when you are promoting our devices. And okay, as Anna said, also the comfort for patient, and then some tips like the after COVID, as you know, hygiene is an issue as well. So we can remove the cover from our electrodes. We can clean them easily and in an accurate way. Okay. And as we said, you can recognize easily which handpiece is working and if it is working. Because I personally, Anna, I saw sometimes they started working, but the machine was not working. And in this way, if you don't have the light, it means that you are not operating the device. Okay. So it's, let's say, a help for the operator as well. Okay, Anna, I don't know if you want to.
Yeah,
shall we?
Yeah. The one before is that we need to use a special cream, a conductive cream, and we have this kind of recipe. Okay, next one, we are going to talk about the contraindications. And we have some, as always, some that we are contraindication and other that we need authorization. So we have the one that we have there, pacemaker, tuberculosis, tumors, fever or infection, like all the treatments, heart failure, acute renal insufficiency, thrombophlebitis, physiosomatic disorders, and nodules. And when we need the authorization is pregnancy. Pregnancy is a problem with the sanitary people, that because you know that we don't have a study that can say that if we can work or we cannot work with this patient. But it's if we have the authorization, we can work with hypertension or hypotension, phlebitis, asthma. What are we going to do? The normal thing is that we are not going to use the hyperthermia, okay? The high temperature. So we can continue one more, please. Okay. And now here this is not for me important how to explain how we use the device for treat the neck or the hand or the other part of the body. But it's very interesting how in these photographs you can see other forms, other ways to use the device. Here we are working with the device in the neck, working there. Okay, next one, please. With the handpiece and the return plate. Here we have, you see, we are working with the movement. We are trying to have a better move in the elbow. So we have the hand, the return plate in the hand of the patient, and we are making a kinesiotherapy at the same time that we are working with our handpiece. Continue, please. Here is the way for work with the return plate with move, the yellow one, and the
dynamic
capacity.
Yes.
Yeah, the dynamic, thank you, at the same time. So what happened there, that we are moving, we have the both handpiece in movement. So it makes that the electricity goes in other way. Continue, please. Here is what I already told you, when you want to work hands-free, you want to lay down the patient, let him or her there, and then let the diathermy works. So you can do other things. Which when can you use this way? Imagine if you have a very important pain or whatever, then you say, okay, I will relax the patient, I will let less the pain, and then I will work. So it's a very interesting way too. This is with the adhesive neutral plate. You see, we are moving or saying to the patient, please move your hand. Okay, come on, move, 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 go, 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 go. And at the same time, we are working with the handpiece, and we have the neutral plate stick in the leg. Again, with movement, we can now stick two. We can stick the return plate and the handpiece. Then both are a stick in the leg, so the movement is what you want. Here, so many physiotherapists use it, for example, at the same time that they are making Pilates. Okay, one more, please. Okay, the TMA kit is what I already says. You can use it for work with the fascia, and you can use it for like the gantros. I don't know in English. I think it's the same. It's
I
like
think
you
yes.
can recover the bones to take out the pain and to take out the fibrosis that you have in the area. You put it soft in seconds. It's very, very, very interesting. The more interesting
And Anna, just to say that the technology is that we have add the TMA to the radio frequency. So this is the, let's say, the advantage, right?
Okay, so if we go this next, I think that we have there a small video looking, and we can look how they works.
There was a video. I don't know what happened. Let me check. Okay. Let me see if it comes. I don't know how much time do we have, Pablo?
We are most over time.
Okay.
And then it could be great to have some questions. So
yes. Okay.
You're about to end, or?
Yeah, we are near to end.
Yes, we are about to end. I mean, we can just, let me see if it works. We can just check very quickly this video. So this is a physiotherapist, an Italian physiotherapist. He's specialized in using these tools and to work with diathermy combined with the TMA. As you see, there is a cable which suits every shape, every tool. So you just have to connect it to the type of tool that you want to work with. Okay, I think we can just this is the physiostatic treatment. Just to say, Anna already said it, but just to not confuse you, of course, it is specially meant for physiostatic treatments, but you can also use these probes, these electrodes, also for small parts of the body. For the, Anna, am I right? For the mandibula, for example, the small one. Okay, so not only for physiostatic. If you want, you can make. I mean, we mainly focus on physiostatic, but it has different application. Okay, not to reduce it only for physiostatic. And as we said, this is the urogynecological option. We also have a short, I think it's a short video. We can check, otherwise we can just let me see. Sorry, I don't know what happened.
Okay, I don't know if while we are looking for the video, if someone has any question, maybe we can try to explain whatever.
Yes, Pablo, you want to ask so your team if they have questions?
Yes, I have read two from the moment, but please you can write down your questions. They are asking if the presentation in English or explanations of the device are in English. Yes. So.
Oh, sorry. Yes, are in English. It was not clear.
No. I think they mean about protocols or how to use
okay,
the device.
yes.
That's the way
So
I
we have,
understand it.
yes. So we have, of course, the user manual, which comes in English. We also have a guideline, okay, which are some suggested protocols depending on the area, on the type of treatment that we are going to do. So if it is musculoskeletal, if it is dermato functional, if it is for a pelvic floor. Okay, so yes, we have this material in English.
Another one is for ulcers. Which of the offered products we have can cover that that pathology? As podiatrists, usually they treat this kind of issues in some countries.
Did I understand what úlceras?
Yes.
Úlceras okay.
Úlceras en
Ana?
español o en italiano.
No te he entendido, es que no he entendido la pregunta, perdóname.
Que las úlceras, que si es con, o sea, para saber si es con la Plus, con la XP, porque la Plus es más completa, pero no sé si trata también eso, la XP o la Compact.
No, it's okay. You can use whatever, all of these devices. Sorry, you can use all of these devices.
Ana, no te escuchamos, no te perdimos.
For the treat. A ver, ¿me estás oyendo?
Sí.
No,
hola,
muy mal.
Ahora sí.
¿Ahora sí?
Sí.
Vale, what I say is that you can use all the devices for treat the ulceras. The only difference is, or the only thing that you need to know is that you have to put the ulcera in the middle. One side you put the neutral plate and not in the ulcera. At the other side you put the handpiece and then the capacitive handpiece, and then you put your electricity working.
Okay.
¿Entendido?
Yes.
Yes.
And you don't need to work with a lot of temperature. We need to work with a medium or low temperature.
Okay. Also, they are asking if is this machine like TENS machine?
Is this machine like?
Like TENS?
TENS machine,
No,
yes.
no, no, no.
No, no, no,
Like a
no.
TENS? No, 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 no. A TENS is, bueno, si quieres, no sé si quieres contestar tú, Wendy.
No, no.
TENS is some electrodes that you put and then you have a current, but it's only for the electricity in the muscles. Diathermy is high frequency.
I think
it's not a
one
thermotherapy.
yes, one important point, maybe we did not stress it that much, is that diathermy provides an endogenous heat. The heat comes from the inside, okay? You do not apply any heat from outside, okay? If you compare it to other technologies. So the heat is a natural process that comes from inside, okay, and which makes the diathermy the main feature of diathermy.
Okay. So
in any case, Pablo, if
yes.
you want to collect even in a second moment some questions, some doubts, some requests by written, you can provide us this, this inquiries, and we can give you some answers as well. I mean, we are available just to just to help you in solving the doubts that you have, and just to make you acquainted with the technology. Okay, this was a first, let's say, introduction, maybe too much because there were a lot of information, but you can review the presentation, of course. And if you have any questions, so your people, please feel free to ask. Okay, maybe to Pablo, or I mean, we can see how to do it.
Yeah.
But we are, of course, available.
Yes. So thank you very much, Gwendolyn and Anna, for your presentation. Thank you all for attending this meeting. As Gwendolyn said, you can ask me your questions, and I will write down to Gwendolyn and Anna if there is any question to give more information about the product. But yes, the product overview is a very good product, and now in podiatry is going growing very fast. Even in physiotherapy, it has a lot of years, but in podiatry, since recently, it's going great.
Okay,
so,
and we think, Pablo, that the key for selling this device is to educate people, to show the items, to show the devices, to let people test and try out the devices. Because Anna is a physio, I was a patient, and believe me, it's very pleasant, it's very comfortable. Okay, as Anna said, it's painless, no pain, it's effective. Okay, you can use it for different issues. Education is the key to sell items. Okay, you have to think about giving education. I think this will help you a lot with potential customers.
yes.
Okay, let me say thank to Anna, because she's so busy. She's everywhere and doing many things every day. So thank you, Anna, for sharing with us your knowledge.
No,
okay.
Thank you very much for all the people that is here and listening to us. And the one thing that I want you to know is that diathermy is wonderful and a powerful device. You have a very effective device in your hands. So the only things that you need to do is to know how to work with it. It will be very good. You will have very good treatments with it. So thank you very much. I'm going to go. So have a good day and
Yes.
see you.
See you. Thank you very much. Bye bye.
Okay. Grazie. Ciao, ciao, ciao.
Grazie mille.